Welcome to Prevent Child Abuse Oregon and Dr. Amy King's online and self-paced trauma-responsive training for professionals working with children and families. In 2020, Prevent Child Abuse Oregon's Community Leadership Council identified a need for trauma-informed support for parents and caregivers during the COVID-19 pandemic. In 2021, we partnered with Dr. Amy King and parent leaders to provide 4 cohorts of trauma-responsive education to 118 families. In 2022, to expand our system-wide impact, we piloted an 8-week professional training series with the Confederated Tribes of Grand Ronde, and then to 5 more cohorts across Oregon. Data showed that 120 trained providers were supporting over 2,700 families. Each year, their impact expands as these providers reach more families. To reach even more professionals serving children and families across Oregon and beyond, in 2024, Prevent Child Abuse Oregon and Dr. Amy King partnered to develop an online, self-paced course. To create this course, we recorded providers participating in the 8-week training. We asked professionals who participated in the recorded training, what were some of your biggest takeaways from this learning?
The first thing that I hope they take away from this is truly feeling like there is value and a real add to the skills that they already bring with them, right? A real development of that confidence, that place of, I understand what we're talking about when we're talking about trauma-informed or trauma-responsive. I feel capable and confident and like I have additional tools that will help support me in supporting the kids and families that I serve.
This training has just been an incredible opportunity, just learning from Dr. Amy and sharing wisdom with my peers.
This is very important for me because, number one, for my family. My whole family now is living here in the United States. I'm very involved with the community, so that work is going to reflect in all the other children, especially in Washington County or in Oregon. No?
This is my goal. This is everything I do this work for, every kid I've ever worked with that doesn't feel seen. We all work with them. We all do the really hard work. And if there are more adults in the lives of children who know this information, instead of compounding hurt, we are compounding strength and resilience.
We connect with families every single day, and they are humbly introducing me into their home. So the most important thing I can do for them and myself is to be trauma-informed and responsive and give them that honor, knowing that I am there for them and I understand their past and their trauma.
I think the biggest thing for me is just being in a group with so much diversity and learning just from other people's stories and backgrounds and culture. I think that helps me become more trauma-informed because then I can understand that everyone has a different perspective, and so I can take that understanding and be able to work better with others.
Hearing what other people are experiencing and how they're handling it and how maybe Dr. Amy would handle it a little bit differently. Just having the wisdom of such an amazing community available is priceless.
It's healing us as providers and professionals as well. So at the same time we experience secondary trauma, seeing parents go through these sensitive times, but we also need the healing and togetherness as well, personally, professionally.
Oh my goodness, I think everybody should take this training, especially people like in the service providing like industries, the teachers, the people who are in social services such as myself, the home visitors, the doctors, the people like running housing departments and any department that's going to be providing services to families.
I hope people walk away from this training with a sense of, I'm a part of something bigger than me, something that is all of us together saying we care about well-being, we care about whether or not our kids and families are supported, and we care about if our providers are supported, right? It's about connection, and I hope that people walk away from this feeling valued and feeling like their well-being truly matters in this work.
If I could say, and I take from this training, it is like we need to give to the community a healing way to process and to become better parents, better teachers, better families.
Thank you for allowing me to be a guide or facilitator or helper or thought partner or however you think of me. It's my honor and pleasure every day to work with professionals, and I learn more from you than you'll learn from me.
Dr. Amy King, licensed psychologist, owner and founder of Dr. Amy LLC, facilitated this training. Dr. Amy's trauma-responsive guidance serves to enhance resilience via relational health and build social-emotional capacity by training professionals that impact the lives of children. Click the link in the description to register for the virtual trauma-responsive training for professionals working with children and families. And a big thank you to our sponsors and community partners for making this trauma-responsive training course possible.